Good. How are you?
Doing well, thanks. Yeah, I'm sorry. I got another meeting ran long, so I'm in my car, but we can still talk. So nice to meet you. Anyway.
Nice to meet you too, officially.
Yeah. Second, let me make.
Getting some notifications. Where should we go from here?
Give me 1 second. I'm just gonna make us live on Facebook, and we're good to go, my friend. Okay, so please. I'd also love to know a bit about your background as well.
I'm sure. I'll start telling you about our company and then our background. Our company is Simply Vital Health. We are a company that allows healthcare entities to share data and provide care coordination and financial risk management on top of that. To accomplish that goal, we had to find a way to allow people to share data. In addition, as we were doing research, we found that there was a big market opportunity in being able to buy and sell data. So that's when we kind of came across that we needed this distributed trustless tool, which we were labeling Health Nexus. That's kind of what we're releasing for an IC or crowd sale. Health Nexus is a distributed system that allows people to buy, sell, and share medical data trustlessly without any third parties. In addition, it gives people access to HIPAA-compliant computational power and data storage. So right now, we're releasing our initial we're selling our initial coins for that release, and that's kind of like what we are doing. Kind of a little bit more about the company. We already have 2 paying customers right now. That's a first in healthcare for blockchain. We're partnered with Athena Health, and hold on, sorry, it's a bit of a long day. And our pre-sale just started. As for me, my background, I came from Capital One previously. I was a double major at the University of Illinois in physics and electrical and computer engineering. While at Capital One, I was a tech lead for their kind of scout R&D team. Specifically, I became their tech lead for their blockchain project. So while there, I worked on a ton of different blockchain concepts. The idea being we build up this kind of like prototype or alpha product and then pass it off to a kind of production line team. I've also worked on some other projects. Worked on an AI team for a bit, dealing with fraud. Worked on quite a few web applications, including MasterPass. After a while of that, my co-founder reached out to me. My co-founder comes from the health medical field, has quite a bit of experience there. She reached out to me because she realized she found this great use case for blockchain, and we started talking. She had this rough idea, which is what we're doing now, and we went and met a hackathon in Nashville called Distributed Health. We ended up being one of the winners for that, and since then we just kept the ball rolling on our product and company. We officially incorporated in February of this year, and quit our jobs in January as we introduced.
Congratulations!
Yeah, an incubator. So that's kind of my background, a little bit on my co-founder's background, and kind of that's our company.
Awesome. So you're selling. Is this something like a storage? Storage token project, or like a I don't know. One of those. There are a couple of different ones.
It's similar. So we're kind of pitching ourselves as kind of a blockchain with protocols built around healthcare. So we're kind of like focused in on the healthcare field. Our first primary goal is for data sharing, not necessarily storage. That's kind of our stretch goal. So our goal has already been, like, we kind of tried out with our customers. That's why we already have 2 customers already. There's also been a lot of research done academically on this. Healthcare is under major financial stress right now.
Yes.
Specifically focusing on the data sharing, not necessarily the storage. So right now, data providers can keep their medical data in the same area without having to worry about it. With our first kind of planned release, healthcare won't need to actually move their data. They're just going to change how people can access it via their already existing databases. So they won't even have to, it will be a very quick and easy onboarding. Further down the line, we're planning on pairing a distributed database storage system with it. But that is further down the line, and it's not something that, I'm trying to think the best way to say this. This will be harder to push out, but it's something that's kind of still useful to healthcare. It's not our main focus right now, basically.
Why is this important to healthcare? That it be on, that you be doing a blockchain project as opposed to one of the existing, one of the other ways of storing data and so on?
That's a good question. So there's kind of two different factors coming into play here. The first one is healthcare internationally, but specifically we're focused on within the US. Healthcare is changing from kind of quantity versus quality care into value-based care. In the US, it started with some regulations passed a little while back, and these regulations are here to stay. Pretty much everyone in the spectrum has agreed this is the way this is going to be now. So on top of that, with this value-based care now, hospitals, to give you an idea, hospitals are now charged significantly more based on the quality of care, and that quality of care is very, very highly affected by what happens in other facilities. So basically, care coordination has the importance of care coordination has significantly skyrocketed. And this is going into kind of the next part, it's going to kind of segue. Currently, they don't really have that capabilities. No other systems have proven to be trustless enough to really accomplish this. So right now, if a hospital is trying to share data with another hospital, realistically, that usually involves hold on, can you still, okay, there we go. Realistically, that still involves the fax machine. So that's currently what they use. Other people have tried other systems with that, but generally speaking, they've just not been trustless enough. That's kind of where blockchain comes in. It just going to the basic.
Meaning that they're worried an email would get corrupted or would be intercepted or something.
They're worried about the third party or the people they're working with doing it. They really like the auditability and the immutability of it. So the fact that they can audit everything everyone does and they can trust that no one can really change it because it's immutable, that's the big factors they like. Because it's not that they worry about the data getting corrupted, it's that they worry about the other hospital trying to steal their patients, the third party leaking. They're worried more about malicious actors.
I see. So how are you keeping that private?
So for the data itself, this goes into the fact that we are doing a new key protocol system. We base this around a lot of academic research that's done. It's been probably about a year kind of working on this and designing this. The way this key system works, it works with kind of like a gatekeeper client. You basically govern access on the blockchain, not the data itself. So we're storing kind of like permission keys on the blockchain that you can then sell and share to people. They'll give people access to your data on your secure database. Down the line, we'd like to pair that up with data storage. That's kind of like our. I'm getting spam right now.
Yeah, I can see someone calling you.
What? Yeah. Either way, long term, we are looking into some distributed data storage systems. Even then, we're not storing data on the blockchain. We're using that to govern access to data.
I see. Very cool. Okay, that makes sense. What about the tokens? Who's buying the tokens and what are they used for?
I mean, for the crowd sale, it's for whoever's interested in and believes in the project. Long term, though, the main utility comes in a few different factors. The first one is similar to Ethereum. It's designed to incentivize the miners, or in our case, the node validators who run the network. In that case, there's a bit of extra incentive because we have a new governance protocol that will help to ensure HIPAA compliance. So our coin is specifically to incentivize HIPAA compliant nodes, which are the only types of nodes that healthcare could really work with. We don't see healthcare being able to, without specific governing protocols like we have, we don't see healthcare being able to adopt a truly public, or not truly public, but a completely unpermissioned blockchain like, say, Ethereum or ungoverned system. Yeah. The other additional big factor would be the medical data selling and sharing. Hold on. Someone keeps calling me. It's part of live pitch, I guess. So the medical selling, sharing, and buying of data is a very large one. It's a multi-billion-dollar industry alone. The sharing is the big factor for us with our current product, but we already had several groups, including some research institutions, come to us about being able to buy medical data with this platform because they have the ability to buy medical data. But right now, because it's all siloed in these kind of like walled-off databases, they have no access to it. So the main people who would be buying it would be people trying to just share data to incentivize the nodes to run the program, and people interested in buying and selling it. Down the line, there will be smart contracts involved. So people who want to run healthcare enabled or healthcare specific smart contracts, like for insurance reimbursements or for other research practices, you would need to use something with this kind of like governed system. Kind of the final one would be the data storage. We are looking at adding in a data storage system. We've already talked to some customers and to our customers and some other people we're working with to see if they'd be interested, if they have extra bandwidth, that they'd be interested in hooking their computer up to our network, if there's a correct incentive to kind of share their data storing power. And they've already said they'd be very interested in that because that's an extra revenue stream for the hospital or the healthcare entity. So those would be the main purposes, kind of incentivizing the nodes, buying, selling, and sharing medical data, and then computation and data storage space.
Now, are you building this blockchain yourself, or is this using an existing blockchain?
So we are starting with Ethereum. We're going to fork the Ethereum project.
You are, so like a private Ethereum blockchain.
Correct. After we fork that, we are planning on running it. If you look at our white paper, we have kind of a roadmap. Long term, this is an open source project, and other people will be welcome to contribute. Our plan is, depending on how much money we raise, to continue that development up to 4 years. After that, we plan to still contribute, but we want kind of the open source community and kind of a governing consortium we will build to kind of take over that lead or take over this project going forward. So we plan to be the developers who start building this and get it to kind of get it working, get it to a nice stage where it can deliver all of its basic uses. And then we plan on kind of sharing the ability to design and build it with the community.
I see. Very cool. Okay, how much are you raising?
So right now we have a different tiers depending on how much we build. We have our hard cap set at 40 million.
Okay.
And
how is that structured? Are you going to be giving away a certain number of tokens in the sale, and then you raise 40 million, then that token is distributed between whoever contributed that, or is it priced?
It's priced. The price will be set closer to the main sale, but right now we will be selling. I can pull it up now, real quick, if you give me a second. But we have a set number of tokens being sold in the pre-sale for a discount or bonus of 40%, and then we have 4 tiers in the main sale with bonuses at 30, 20, and 10%, then 0%.
Okay, I'm with you. Okay. And are you doing any kind of affiliate program or anything like that?
By affiliate, do you mean like a referral program, or?
Yeah, like these sharing links and things like that.
Yeah. So we have a bounty program for this, and we do have a referral program for people who bring in kind of and a referral program for people who bring in people to the crowd sale. So we do have 2 programs for that.
Okay. What kind of marketing team do you have for the ICO? For the token sale?
Currently, we're working closely with Token Market. We have a employee focus on growth on our end, but the primary team we're working with right now would be Token Market.
Okay, cool. All right, and you said it's live now?
Yes, it's live now.
Okay, where can I go to check it out and read more?
You can go to www.tokensale.com or .simplyvitalhealth.com. I'll include a link in the description for this pitch and update it with that. You can go there.
Also post as a comment to this video if you'd like as well.
Oh yeah, I'll add the comment to the video just so everyone has the access to the link. But you would go to tokensale.simplyvitalhealth.com. You can also look up our Twitter tag or our Telegram feed as well. Our Twitter tag is Simply Vital Health HQ, I believe.
Health HQ?
Yes. Let me double check that. I am not that active on Twitter. It's Simply Vital HQ. Sorry about that. Twitter isn't my strongest following. But yeah,
no worries. I rarely use Twitter myself, but yeah. Okay, cool. So this is interesting. I actually haven't spoken to many people who are doing health specific blockchain projects, and I wasn't really aware there was that much demand for it. But what you told me, it sounds like it could be really useful. So that's cool to know.
Yeah, it was. Go ahead.
No, go on.
I was gonna say it's actually one of the most looked at fields after finance.
Is that right?
Why you're only beginning to see things pop up now. We spent about a year doing research and kind of working on our alpha product first, kind of in stealth mode. But there's been a lot of academic research on this field already, so there's a lot of hype in it. You're probably gonna be hearing a lot more about healthcare and blockchain in the next kind of couple months.
Oh, very cool. Do you have a GitHub?
We do. So we actually just published just made public our first true code for that. Give me one sec. I can add that to the comment links right now.
Okay.
So long term, like I said, we're forking the Ethereum project, but we are also including day one usability via smart contracts to kind of like demonstrate an alpha version for the key system we're proposing. So you can view that at Health-Nexus on GitHub, and I will post about that there.
Cool. All right. Well, I'm going to check it out, and I'll sign up and receive notifications about your ICO, and yeah, maybe get involved in some way.
All right, sounds good. If you have any questions, once you go to our site, there should be a link to our Telegram and Discord channel where one of us is usually available to answer any questions that come up.
Awesome. Thanks for your time. Yeah, I really appreciate you coming on. And by the way, you may be contacted by other people who view this and through the platform. So just be on the lookout for notifications and so on.
All right, we'll do.
All right. All the best.
You too. Thanks. Bye.